Hi, I'm Dr. Angela Mazza, and I'm an integrative endocrinologist from Central Florida. This is our practice, Metabolic Center for Wellness. Today's topic is thyroid cancer. Thyroid cancer is a cancer that starts in the thyroid. Although thyroid cancer in most cases is very treatable, the key is early diagnosis. Thyroid cancer may be found if you feel a lump on your neck, but more commonly it has no symptoms at all. There are 4 types of thyroid cancer. Papillary thyroid cancer is by far the most common and grows very slowly. Follicular, the second most common form, it also grows very slowly. Medullary, just about 10% of the cases at most, it tends to be more aggressive. And then finally, anaplastic, which is very rare but very aggressive. Stay tuned for more on thyroid cancer. Today we continue our discussion on thyroid cancer. Thyroid cancer is diagnosed by an ultrasound-guided fine needle aspiration or FNA biopsy. This is a procedure where a trained doctor uses very thin needles to take thyroid cells from your nodule. Usually anywhere from 3 to 4 passes into your nodule are made, each lasting about 10 seconds. I know this sounds very scary, but it should be fairly painless, or at least not too uncomfortable of a procedure. Now these samples are specially prepped and sent to a pathologist for evaluation. The pathologist will be able to read the cells on the slides and see if they are suspicious for thyroid cancer or not. Stay tuned for more on thyroid cancer diagnosis. Today we continue to discuss thyroid cancer diagnosis. Now sometimes the pathologist doesn't see cancer but is concerned about the risk of the cells becoming cancerous. That's when molecular testing is performed. There are a couple of different companies that do this testing. But basically, these tests use DNA and RNA sequences that give a risk stratification for thyroid cancer. These tests are very sensitive and specific and will provide your doctor percentage risk for cancer. Now, these tests take about 10 business days to receive the results back. If this testing is performed, it doesn't necessarily mean a bad prognosis, so try not to worry too much while you're waiting. Stay tuned for more on thyroid cancer. Today we continue to discuss thyroid cancer. So say your biopsy comes back consistent with thyroid cancer. Treatment options will depend on a number of factors. First is the type of cancer. As I mentioned, papillary is the most common type. Second, it depends upon the size. And third, depends upon if the tumor invaded the capsule of the thyroid or spread to nearby lymph nodes. If the nodule is papillary and very small, options may include observation, having one lobe of your thyroid removed, or even radiofrequency ablation or RFA. If the nodule is larger, you may need a total thyroidectomy followed by radioactive iodine treatment. Stay tuned for more on thyroid cancer. Today we continue to discuss thyroid cancer. What is radioactive iodine or RAI? And when is it used for the treatment of thyroid cancer? Well, it's a type of internal radiation therapy that uses iodine-131 or I-131 to treat thyroid cancer. It's taken as a pill, and the radiation destroys thyroid cells, including thyroid cancer cells. RAI is often used after surgery for thyroid cancer or when the cancer has returned or spread. It's most effective for papillary and follicular thyroid cancers. It doesn't work for all types of thyroid cancer. RAI can cause short-term side effects like nausea, vomiting, and neck tenderness. RAI therapy requires strict safety protocols to protect others from radiation exposure. Stay tuned for more on thyroid cancer. Thanks for listening, and that's your Thyroid Talk tip for the day. Don't forget to check out the Thyroid Talk podcast, and please subscribe to the YouTube channel.